All right, we're going to start up chapter 20, therapeutic agents for cardiovascular system. Homework pages are 291 to 296. Up to you if you want to do the system identifier. That's extra credit. I've been giving those who have been doing it extra credit. 10 points or so. Labs for chapter 20 are 20.4 and 20.5. Get your chapter 17s in, chapter 3 in if you have not. And yeah, we're gonna start chapter 20 now. Yes. Chapter 17.
Mhm. This is all I could find for Lab 3.3 on that website. Is that
Okay,
so? Do I just look those up?
let me see if I can find something else for you.
Okay.
Hold on to that.
Okay. Thank you.
Which one was it?
The one from Wednesday, 5, I think. Yeah, I think it's.
Okay, 5, yeah. Should be open.
Oh yeah. No, but I have your laundry to print it in it. So
All right. If you're having trouble on chapter 3 lab, I'll help you out on the going in the link as far as about the Texas State Board. I'll help you out. I'll give you some more information in regards to that. But I'm gonna go ahead and start chapter 20.
Chapter 20, Therapeutic Agents for the Cardiovascular System.
Oh, and I'm not too focused on the anatomy and physiology of it. It's just the medications. Those who barely came in, chapter 20 homework pages are 291 through 296, up to the short answers, and lab 20.4 and 20.5.
I'll skip over the terms and definitions for now, but we'll go through them as we progress through the chapter. There's quite a few for this.
And make sure y'all do start getting into these medications because there's quite a bit of these.
Chapter. This table lists a lot of common drugs for conditions of the cardiovascular system, and of course, all of their pronunciations. We'll also go through those as we progress through the chapter.
That table starts on page 447. It'll help you out a lot as far as the pronunciation, but it does give the drug class, like alpha blockers is a drug class, antiarrhythmic is a drug class. Angiotensin converting enzyme inhibitors or ACE inhibitors is a drug class. Angiotensin receptor blockers, drug class. Also keep in mind on how they kind of end the suffixes. Well, ACE inhibitors, they usually end in pril. Angiotensin receptor blockers or ARBs end in sartan. Beta blockers end in OLOL. Calcium channel blockers usually end in DIPINE, dipine. There's any more? Anytime you see statin, that's going to be dealing with cholesterol. So that's an anti-hyperlipidemic agent. You have diuretics. There's not really any suffix to go by that. The thrombolytics usually end in place. So you have alteplase, retaplase, and tenecteplase. So make sure you go over that. That's 447 and 440 through 449 in the book.
Heart sits in the chest cavity between the lungs. It is a large muscle about the size of a fist called the superior vena cava and the inferior vena cava.
We did all that in pathophys.
So you can kind of see how it works throughout the lungs. Blood flow increases, causing a rise in blood pressure and vice versa vessels. The blood flow depends on heart rate and force of contractions. When the heart works harder to increase cardiac output, blood flow increases, causing a rise in blood pressure and vice versa.
So again, we're talking about hypertension, high blood pressure, and we're about to start talking about certain medications that treat certain blood pressure, high blood pressure.
Also affects blood flow. For example, if blood pressure can fall in a dehydrated patient, or it can rise with excess body fluid. We express blood pressure readings as systolic over diastolic pressure. Peripheral resistance is resistance to blood flow caused by blood viscosity and the force required to pump blood through the vessels. When peripheral resistance increases, blood pressure increases. As the diameter of blood vessels decreases, vasoconstriction, peripheral resistance increases. Vasodilation, on the other hand, is an increase in blood vessel diameter that results in a peripheral resistance decrease. Hormones can also regulate blood pressure in response to low blood pressures. Kidneys release renin. This enzyme acts on a plasma protein, initiating a series of reactions that produce angiotensin II, a hormone that causes vasoconstriction.
You will see like this diseases, certain diseases of the heart affect certain diseases of the kidneys and vice versa. Once your kidneys start going out, that just means you're not able to release all these extra the water within you, and it could affect your heart. Have you have an enlarged heart, cause congestive heart failure and whatnot.
Tensin II also acts indirectly to maintain blood pressure by signaling the adrenal glands to increase their aldosterone output. This hormone increases kidney sodium retention, resulting in greater fluid retention and increased blood volume. This system is the renin-angiotensin aldosterone system.
So anytime you hear about renin, aldosterone system or angiotensin aldosterone system. Think about the kidneys filtering the body out. Once that this is why people begin to get on dialysis, because their kidneys are starting to not function as they should.
Because many different agents treat heart conditions like coronary artery diseases and their causes, hypertension and high cholesterol, it's important to not only understand the medication types, but their mechanism of action and possible side effects. Before discussing individual cardiovascular conditions, let's first discuss some common drug classes for cardiac conditions. A, B, C, D, the mnemonic works for blood pressure medications such as angiotensin converting enzyme, ACE inhibitors, beta blockers, calcium channel blockers, and diuretics provide a framework to remember these drug classes.
All right. So A, B, C, D, use that mnemonic in regards to understanding what different types of drug classes fall within the cardiovascular system. So you have angiotensin converting enzyme or ACE inhibitors. You have beta blockers. Calcium channel blockers. And diuretics. A, B, C, D.
Table 20.1 lists select drugs used in the treatment of cardiovascular conditions. So you can see for angiotensin converting enzyme, I've highlighted that the general use is for hypertension. If you look at all of these generic names here, they all have krill as a common ending, and their general effect is to prevent blood vessel constriction.
All right, so those that end in prill are for hypertension. They treat hypertension or high blood pressure. They end in prill. So you have benazepril, captopril, and these are all generic names. Fasanapril, lisinopril, which you'll see a lot of. Moexapril and ramipril, you'll see a lot of. So again, ACE inhibitors and then pril. Make it easy for you to kind of remember that and understand which different medications fall under that. So drug class, ACE inhibitors, and the enalapril and generic names, understand those. And don't forget about the brand names. These are all the brand names as well. So they prevent blood vessel constriction, hypertension.
Antiplatelet agents are used for thrombosis. They prevent blood clot formation, such as.
Okay, so you see aspirin. Oh, take this off. That's an antiplatelet agent. That's why a lot of doctors recommend take for older adults that are susceptible to heart conditions. The doctor will ask them or prescribe them an 81 milligram aspirin. And you also have clopidogrel, which is also an antiplatelet.
Aspirin, clopidogrel, Ecotrin, which is aspirin.
And that just means that it just keeps the blood from clotting.
Beta blockers. If you look at all of these, they all have an LOL ending or OLOL ending.
So beta blockers end in OLOL. And again, they treat hypertension. So whenever you see ace-butylol, bisoprolol, metoprolol, you'll see a lot of that. Nadolol, Pendolol, you should automatically think these are beta blockers. They treat hypertension or high blood pressure, and they reduce the workload of the heart. Also become familiar with the brand names to those.
Then sequestrants. They lower cholesterol. We have Prevolite, Questrin, Colistid. We have calcium channel blockers for hypertension, diuretics for hypertension and edema that reduce fluid volume.
There's not really any way to remember calcium channel blockers, but that they do treat hypertension and it's for increased blood flow and decreases vessel constriction in the heart. There's no suffix or prefix or infix for those. Just kind of have to remember those calcium channel blockers.
We have calcium channel blockers for hypertension, diuretics for hypertension and edema that reduce fluid volume.
So diuretics are for hypertension, but they also reduce fluid volume. Some known diuretics are furosemide, which is Lasix brand name. Also, you have your thiazide diuretics, which hydrochlorothiazide. We have to be careful using furosemide or Lasix because they deplete us from potassium. So when we have real low potassium, we become fatigued, weak. So we really have to replace that potassium with the medication. So they'll usually whenever they give us furosemide, they're going to give you some potassium with it because it excretes a lot of potassium because you're urinating a lot. Thiazide doesn't do so much on that. It's potassium saving, called potassium saving diuretic. Doesn't really excrete so much potassium. So you'll have some people take hydrochlorothiazide for that. And that's for swelling, edema, stuff like that. Just gonna start talking about statins. They're hypocholesterolemia. They're statins. And they treat cholesterol. So anything that's in statins, such as atorvastatin, lovastatin, pravastatin, simvastatin, or think of those as low cholesterol or cholesterol medications to lower cholesterol.
Angina treatment. So
I skipped nitrates. Nitroglycerin's the main one there. Angina is the tightness of the chest, or if you feel like you're having a heart attack. These are the little bottles that they give you or give older patients to prevent heart attacks, to open up the vessels within the heart.
they relax blood vessels, allowing more blood to reach the heart. ACE inhibitors help reduce blood pressure by dilating arteries. The ACE inhibitors' net effect is peripheral vasodilation and blood pressure lowering. Lisinopril is a very common ACE inhibitor. Benazepril.
So those in Eninipril are ACE inhibitors.
Angiotensin II receptor antagonists, also known as angiotensin II receptor blockers, ARBs, work by inhibiting the effects of angiotensin II on angiotensin II receptors. The net effects are very similar to those ACE inhibitors, including a reduction in blood pressure due to net vasodilation.
So most ACE inhibitors, well, what was that one?
That class, we have Cozar, Diovan.
Go back real quick. So most angiotensin II receptors usually end in sartan. So those are ARBs. We'll give it the short form, ARBS, ARBs, angiotensin II receptor antagonists. Also known as ARBs, are in sartan. So they reduce blood pressure due to net vasodilation. So that's dealing with blood pressure as well.
The net effects are very similar to those ACE inhibitors, including a reduction in blood pressure due to net vasodilation. That class, we have Cozar, Diovan. And we just talked about this when I was going through the chart, but ARBs have that common ending of sartan. ACE inhibitors have the common ending of pril, and beta blockers have that common ending of OLOL. In 2015, the FDA approved Entresto, a combination medication for heart failure. It contains valsartan, an ARB, as well as a novel medication called sacubitril that inhibits neprilysin, an enzyme that normally affects endogenesis peptides involved with blood pressure. Another way to alter the renin-angiotensin-aldosterone system is to use Tecturna, which inhibits renin, resulting in many downstream effects, including reduced aldosterone secretion, less water retention, and less vasoconstriction.
Okay, so we're dealing with renin, we're dealing with kidneys. Anytime you see renin and dealing with the kidneys, and they have less water retention and less vasoconstriction. So
beta blockers block both norepinephrine and epinephrine from binding to beta adrenergic receptors. Blocking these receptors reduces heart rate, which can help lower blood pressure and regulate heartbeat in patients with tachycardia.
okay, so patients with tachycardia, what is tachycardia? Fast heartbeat. So this is aids in tachycardia. That is beta blockers. And they end in OLOL.
Some examples: atenolol, used for hypertension, angina, and myocardial infarction, like a heart attack. Metoprolol tartrate and succinate. Propranolol, which is used for a lot of different things now: hypertension, angina, atrial fibrillation, tremors, migraine prophylaxis, and is even used for chest pains and anxiety and things of that nature. Calcium channel blockers reduce the heart muscle and blood vessel calcium influx. This leads to vascular smooth muscle relaxation, which leads to vasodilation and lower blood pressure. The two main CCB classifications include dihydropyridines and non-dihydropyridines. Some examples: Norvasc, Carbazam.
And again, there's no really set suffix for calcium channel blockers. Just kind of have to know those.
Hypertension or high blood pressure affects millions of Americans. The disease gained the moniker silent killer because few obvious signs accompany it. When the cause of hypertension cannot be established, we call it essential hypertension. Hypertension with a known cause is called secondary hypertension. Some patients with severe hypertension may have symptoms such as nosebleeds and or headaches. However, most people are asymptomatic. Here's box 20.1 is a chart with all of the different classifications of blood pressure. So normal is below 120 for systolic and below 80 for diastolic. Hypertensive, going all the way to the bottom, is a systolic over 180 and a diastolic under 120.
For the most part, as you get older, your systolic and diastolic will start increasing. Hopefully not too high.
Table 20.2 lists select medications used for the treatment of hypertension. We already talked about the ACE inhibitors, beta blockers, ARBs, direct renin inhibitors, calcium channel blockers. Loop diuretics, we haven't talked about yet. We have Lasix and Bumex.
So 20.2 is located on 456. That'll give you a lot of help as well.
Diuretics, microzide and diuryl, metolazone. Potassium sparing diuretics like aldactone and triamterene. Alpha-1 receptor blockers, which we talked about not in this chapter, but other chapters. Alpha-1 receptor blockers, doxazosin, terazosin, and prazosin. Those are all used for heart conditions, and they can be used for BPH and male. Alpha-2 adrenergic agonists like Aldomet and Catapres. Hypotension is low blood pressure. One of the more common problems that people experience is orthostatic blood pressure. This occurs because a large amount of blood remains in the lower extremities, the ankles and feet.
So whenever a person is the swelling on the bottom of their feet or the extremities, sometimes that could be dealing with hypotension.
Quickly, the blood returning to the heart decreases considerably, and the body responds by increasing the heartbeat, compensating for the lack of blood flow. Medications used for the treatment of orthostatic hypotension are fludrocortisone, midodrine. Hyperlipidemia, also known as hypercholesterolemia.
So lipidemia, cholesterolemia, those pretty much go hand in hand, and we're just dealing with high cholesterol here.
Bloodstream cholesterol level increase that can lead to atherosclerosis or arterial hardening. Atherosclerosis increases the incidence of angina, heart attack, and stroke. When discussing body fats, it is important to recognize that cholesterol is only one lipid type, and it performs many vital functions, including steroid hormone and cell membrane synthesis. When people eat high fat and high cholesterol foods, they often ingest too much. This leads to a body fat buildup. In addition to diet, hyperlipidemia is also an inherited condition, meaning you get it from your family members. The most widespread genetically associated disorder is familial hypercholesterolemia. Blood tests measure serum levels of different cholesterol levels, such as low-density lipoproteins and high-density lipoproteins. The LDL function is to carry cholesterol to the tissues, where it can lodge in blood vessel walls and contribute to atherosclerosis. HDL or good cholesterol removes cholesterol from the arteries and transports it to the liver.
So where we can find HDLs is usually like your avocados, um, nuts like your peanuts, walnuts, pecans, stuff like that.
Triglycerides are another form of cholesterol linked to atherosclerosis development. Table 20.3 lists select medications used for the treatment of hyperlipidemia. In nicotinic acid, we have niacin.
Has anybody taken niacin before? It's like it works like I guess I would say a diuretic, but it causes the body to warm up and makes you feel flushed. But it does also excrete the body from um, excess water.
Acid sequestrants, we have Questrin, Colistin, Welchol. For statins, which
So I guess they were talking about bloating. So cholestyramine, cholesterol, cholesterol, all are pretty much like fiber type of medications. So they deal with bloating, constipation, upset stomach.
are a nickname for HMG CoA reductase inhibitors because they have a common ending of statin. Atorvastatin, lovastatin, pravastatin, simvastatin, rosuvastatin, fluvastatin.
So those are known as HMG CoA. And in statin, they treat cholesterol. And again, atorvastatin, lovastatin, pravastatin, simvastatin, rosuvastatin, and fluvastatin. They all end the same.
Fibrates like gemfibrozole and fenofibrate. The only cholesterol absorption inhibitor, Zetia. PCSK9 inhibitors like Praluent and Repatha. Omega-3 fatty acids such as
So see a lot of people who take omega-3 fatty acids. And this is another what was it? Was I going to say? It was another good cholesterol type of. So if you eat fish, good cholesterol.
which is not the same fish oil that you get over the counter. It's a prescription strength Lovesa. Bile acid sequestrants such as cholestyramine increase cholesterol loss through the GI tract. They do this by binding to GI tract bile acids to prevent reabsorption. Because bile acids are made from cholesterol, the loss of bile acids through the feces has a net effect of lowering cholesterol levels. Fibrates such as gemfibrozole and fenofibrate are less effective at lowering LDL cholesterol, but can increase HDL levels and lower triglycerides. Because of this, they are frequently used in combination with statins in people with persistently low HDL and high TG levels. The exact mechanism by which fibrates affect cholesterol is still not known. Nicotinic acid, niacin, is a B-complex vitamin that reduces LDL and TG levels and increases HDL levels. Although the exact mechanism by which niacin treats hyperlipidemia is unknown, the effect may come from niacin's role as a vitamin. Zetia is an oral medication approved as a monotherapy or in combination with statins or fenofibrate for hyperlipidemia. Heterozygous familial Hypercholesterolemia is a genetic disorder that results from a defect on chromosome 19 that codes for low-density lipoprotein receptor, which is a protein found extensively on liver cells that binds to and clears LDL from circulation. Prescribers can use high-dose statins, bile acid sequestrants, or a relatively new medication class called PCSK9 inhibitors. They break down LDLR, reducing LDL. And there's 2 medications in the US that are currently available, as mentioned previously, Praluent and Repatha. Atherosclerosis is a syndrome, which is more than one condition that affects arterial blood vessels. Inflammation occurs as a result of the lifelong buildup of small plaques, mainly composed of lipids and the clumping of platelets. Over time, small injuries can occur in the vessel wall. Arteriosclerosis is a condition that results from thickening, loss of elasticity, hardening, and calcification of arterial walls. Hypertension, hyperlipidemia, diabetes mellitus, and normal aging all contribute to arteriosclerosis progression. Often when someone has atherosclerosis, they're also going to have arterial sclerosis. Angina results from a decrease in cardiac blood flow, which causes chest pain or a sense of pressure. The pain can vary from minor to severe. Hardening of the arteries, hypertension, and cigarette smoking can decrease blood flow. Environmental and genetic influences can also play a role in acquiring chest pain. The 3 angina types include 1, stable angina, 2, variant angina, 3, unstable angina.
So she's about to start talking about certain nitrates. Nitroglycerin's the main one here. And then you got isosorbide mononitrate and isosorbide dinitrate.
Table 20.4 lists select common nitrate agents. Nitroglycerin has a bunch of
which all treat chest tightness, chest pain.
different types of medications and a bunch of different dosage forms. Isosorbide mononitrate and dinitrate. You can see here's a prescription for nitroglycerin, 0.4 milligrams sublingual. They want them to take 1 tablet sublingually every 5 minutes times 3 doses. If no relief, call 911. The formation of a vessel clot blocking blood flow is a thrombosis. Coagulation, blood clotting, is a normal body function aimed at stopping hemorrhage and starting healing. Unfortunately, our bodies can also form unwanted blood clots. This clotting can occur because of an overactive clotting mechanism that can be genetic, results from a narrowing of the arteries, or may be due to prolonged inactivity. An embolus is a blood clot that is broken away from the thrombus, the main clot, and traveled through the body to another area where it can become lodged and create a blockage. Thrombi and emboli can precipitate myocardial infarction, stroke, or deep vein thrombosis. Table 20.5 lists select anticoagulant and antiplatelet agents.
So all these medications will help you out with blood clotting, would help out in preventing strokes for the most part, and heart attacks. So you have warfarin, you have heparin, dalteparin, and enoxaparin. A lot of these, well, enoxaparin you'll see a lot of in the hospital. Heparin as well, unless they prescribe it to you, so that you have to take it at home if you're, that bad of a shape where your blood just keeps on clotting. Warfarin is usually a PO, given PO. Again, if you have to take this, you have significant high rate of blood clotting. And again, you see aspirin and clopidogrel here. These are antiplatelet agents also aiding in blood clotting.
Warfarin, heparin. We have antiplatelet agents like aspirin, clopidogrel, xylostazol, factor XA inhibitors.
So all these are dealing with blood clots. These are different types of drug classes here on the left, and these all deal with blood clotting or to keep the body from clotting.
Saban, Eliquis, direct thrombin inhibitors, Pradaxa, Reflutin, glycoprotein 2B23A inhibitors like Aggrastat or integrilin.
And a lot of these are IV. So you're going to be getting these when you're in the hospital for the most part.
Thrombolytics such as Activase, Retivase, or TNKase.
You'll see a lot of alteplase given, Activase. Again, these all help and aid with blood clotting. So we're trying to keep a person from stroke or heart attack.
Like Aggrastat or integrilin. Thrombolytics such as Activase, Retivase, or TNKase. Another type of anticoagulant is warfarin. Unlike heparin, orally administered warfarin is for long-term use and usually taken once a day. Warfarin interferes with vitamin K-dependent coagulation factor synthesis in the liver. Prothrombin time and international normalized ratio test monitor how long it takes blood to form clots while the patient is taking medication. A warfarin overdose can potentially cause life-threatening bleeding. It interacts with many prescription medications, OTC products, herbal supplements, and even food.
So if you're on warfarin, you need to watch out. If you eat a lot of greens aid in lower keep you from blood clotting and whatnot. So foods such as broccoli contain a large amount of vitamin K, which may counteract with the effectiveness of warfarin. Other foods high in vitamin K include liver, Brussels sprouts, spinach, Swiss chard, coriander, collards, and cabbage.
The medication class that reduces clot formation is the antiplatelet class. Drugs in this group include aspirin, clopidogrel, and Efient, among others. Antiplatelet agents bind directly to platelets, inhibiting aggregation and clot formation. If coronary blood flow to a heart area becomes entirely blocked because of a thrombus or embolism, that area of the heart muscle cannot receive necessary oxygen. This results in heart muscle death, a condition known as myocardial infarction, also known as a heart attack. Select agents used in the treatment of acute coronary syndrome and myocardial infarction are in table 20.6.
So for the beginning of a heart attack or prophylaxis of a heart attack, we would start off with nitroglycerin, sometimes isosorbide mononitrate or isosorbide dinitrate.
Vasodilators and anti-anginal medications like nitroglycerin and isosorbide. We have opioid, morphine, gas, oxygen, beta blocker, metoprolol, anticoagulant, heparin, thrombolytic, alteplase, antiplatelet in combination with.
So if you have had a heart attack or had a heart attack, the doctor usually going to prescribe some clopidogrel, nitrostat, stuff like that.
Aspirin. Transient ischemic attacks are caused by a short period of reduced oxygenation to the brain. This can be due to an atherosclerotic cerebral vascular disease, TIAs are similar to strokes, except that TIA duration is much shorter, with typically no permanent loss of function. The two types of strokes are ischemic clot strokes and hemorrhagic bleeding strokes. Hemorrhagic strokes can occur when weakened vessels or aneurysms in the brain rupture. When a vessel ruptures, blood flows into areas of the brain, causing damage. Additional injury is caused by the lack of oxygenated blood flow to areas of the brain where it is needed. Most of the symptoms of TIAs and strokes may appear rapidly. Heart beats in a regular rhythm. This is accomplished via special fibers that run through the heart. The pacemaker is in the SA node. Many factors influence the efficient operation of the pacemaker, including chemical balance. If an imbalance results from chemicals, like electrolytes, or oxygen deprivation, irregular heartbeats, or dysrhythmias can occur.
Okay, so we're talking about the electrical current of the heart. He's dealing with the SA node, and these medications are for anti-arrhythmics.
Medications can also cause dysrhythmias. Depending on the severity, acute care may or may not be required. Table 20.7 lists select agents used in the treatment of arrhythmias.
So if your heart is not beating the way it should be, they'll give you either a sotalol, amiodarone. I see a lot of amiodarone dispensed to get that heartbeat back to where it needs to be, unless you got to get shocked with the AED.
Name kind of goes along with what it's for. Cortisone, Pacerone, Lanoxin, Norpace, Rhythmol, another one that kind of goes with it. Voltec, xylocaine. Heart failure is a progressive disease in which the heart cannot pump enough blood to meet the body's oxygen and nutrient demands. Edema is a characteristic heart failure component because the kidneys compensate for the lack of blood flow by retaining more fluid. This fluid increases the heart's workload, further weakening it.
So again, we're dealing with kidneys. If they're not secreting right or eliminating the body of water or excess water, you'll start to swell up and become bloated or very swelled up in the ankles. Also affecting the heart as far as the way it beats, and can cause congestive heart failure.
Table 20.8 lists select agents used in the treatment of heart failure. Acute heart failure, loop diuretics,
There's loop diuretic again. That's furosemide. Again, we got to watch out for that one because it's not potassium sparing. It'll eliminate everything, all the excess within the body. So we're going to need a potassium to take with this furosemide.
Natriuretic peptide B types, adrenergic agonists, phosphodiesterase and enzyme inhibitors. For chronic heart failure, ACE inhibitors, beta blockers, loop diuretics, thiazide diuretics, cardiac glycoside, aldosterone inhibitors, vasodilators. Digoxin is a very popular medication used in both outpatient and inpatient pharmacy. It's indicated for heart failure or atrial fibrillation. It's popular because can be given orally or be administered, injected into a patient. The antidote for a digoxin overdose or symptomatic toxicity is digoxin immune fab. Digibind. This agent binds to the digoxin molecule and the drug is excreted from the body. This treatment must be done in the emergency department and the antidote is available in injectable form only. Lastly, take a look at these sound-alike look-alike drugs, Cardine versus Cardizem, Lodazin versus Lirozole.
So that's all of chapter 20. Just make sure you keep keep in mind all the different types of drug classifications and how they end. I know there's some exceptions as to they don't have a suffix, or infix, or a prefix. But it does make things easier when you're learning all the different types of medications for the heart. Furosemide is known as a loop diuretic. Again, it's not potassium sparing. And you have your thiazide diuretics and, might spare some potassium in your body. There's a lot of meds for chapter 20, so I would dive into it. What's that?
The last for 20.
Yeah, 20.4 and 20.5. Y'all have a great day.
Thank you.
Yes, yes, sir. Okay.
For 3.